Believe it or not, once upon a time, I was a pharmacy major in college, and I have a lot of friends who have since become pharmacists. And they talk about how when they're at a hospital or, all these different situations, a pharmacist is now really a part of a more holistic healthcare team. It's not a general practitioner, really carrying the team and doing all the work. So how do you find a pharmacist can be a part of your not generic, but your general healthcare team? I think a lot of people have just pushed towards physicians for a while, but what do you offer to add to that value?
Yeah, I mean, the thought process on that should be it should always be a team. So obviously, when you're inside of a hospital, it's a little bit more of a one-on-one team. So you'll have daily meetings with a provider, a pharmacist, the nursing, the social worker. Everybody will come together to look at your plan, and what they can do to get you better and get you discharged. And everybody has something to contribute. On an outpatient level like this, it's a little bit trickier because you're not getting the one-on-one interaction. You don't have these close relationships with every single provider in the area, but it just has to have open communication. So, the providers, they're going to be the experts at diagnostics, and then your pharmacy is going to be, your expert at medication therapy management. So, just being the link between the patient and their multiple doctors is one of the most important things. So, you know, Mrs. Smith goes to her cardiologist. She's on this blood pressure medication. He says you have to be on this no matter what. It's important for your health. And then she goes to the nephrologist, and the nephrologist says you can't be on this because of your kidneys. You have to stay off it. And the patient is stuck in the middle. So then that's a good opportunity for the pharmacist to come and to kind of intervene and to be the link between both and maybe offer a better solution or a better medication that'll suffice for both of them. Because a lot of times there's a lack of communication between all the different specialists that the patient goes to. So that's a very important thing that the pharmacy does.
Yeah, it's awesome. It's not even something I would think about. If you have, one drug that doesn't interact with another, you might say, okay, both doctors don't know. They're kind of siloed away that there could be a dangerous interaction until they get to you. And then that situation changes.
People assume that all their doctors are always informed on what's going on, but sometimes the information can get there too late. You can go to a primary doctor and they can initiate you on a medication, and they're supposed to inform all your other doctors of what's going on, but that information can get there a little too late, or by the time your other doctor takes a look at it, you could have been on this medication for a week or two. So that's where the pharmacist comes in and just makes sure that there's nothing that's going to harm you at the end of the day. And if there is, stop it, don't initiate it, and just counsel the patient, counsel the doctor, and just be part of that team.
Yeah, no, it's great to hear, and it's good to hear that there's safeguards in place in case something like that happens. So definitely appreciate that and can see it. Thanks again for tuning in to Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we will see you in the next episode.